And I think also, even when we think about individuals with health insurance, good health insurance, and we think about residential treatment facilities and programs, oftentimes insurance companies won't cover the entirety of the stay. So I think that's something else that patients run into. Oh, all of a sudden, my coverage just got cut off, right? I was expecting to be here a lot longer.
Welcome to OCD Whisperer Podcast. Today with me, I have Jonathan Teller, who's a third-year clinical psychologist, PhD student at Northern Illinois University. His research interests are focused on the factors and mechanisms that impact the onset and maintenance of anxiety and obsessive-compulsive disorders. He is particularly interested in examining how cognitive behavioral therapy and exposure and response prevention therapy can be enhanced to improve clinical treatment outcomes. He is also passionate about increasing access to mental health care, deconstructing the stigma around mental health care, and advocating for mental health. Welcome to the show, Jonathan.
Thank you, Kristina. Thank you so much for having me.
Absolutely. I'm actually really glad you're here. And I appreciate, as I said right before we started recording, your patience, because it took us a second to find a good date and time. And I think we have a really important topic here. We're talking today about essentially the role of self-advocacy in healthcare. And I mean, I think generally that's such a big topic, right? And I think it can be a tough thing to do, especially depending on who you are and where you come from in the world and in life. And, how do you do that? So considering it's a big topic, I'd love to hand it over to you and kind of get us going. Like, what's your take on this? What would you like to discuss about that would be helpful for people?
Sure. So I think this is a very important topic that oftentimes might not be given enough thought, and something I'm really passionate about. So when I think of self-advocacy in healthcare settings, I think, for example, if one is in treatment for mental health and they are receiving a specific type of therapeutic intervention, and that intervention might not be working for them, it could be very difficult for the patient to speak up and say to the clinician, hey, is it possible for us to try a different type of therapy modality? This, isn't really working. I've given it my best effort, but I'm just not really seeing any type of improvement. Additionally, if someone's taking medication, right, whatever medication that might be, and they've given it, whether it be 3 months, 4 months, 5 months, 6 months, whatever period of time the psychiatrist recommends before one might see the full effects, and that medication is not working for them. Oftentimes patients don't speak up and say to their doctor, is it possible for us to add something on, or is it possible for us to switch up this medication? So I think these are really important topics and things that patients often struggle with. With that, I think there are reasons why they struggle with these topics. I think there are internal and external barriers. So when I think of internal barriers, I think, for example, a patient having anxiety, right? Mm-hmm. Well, if I speak up, maybe I'll insult the therapist, and maybe I'll make myself look silly, or do I know what I'm talking about? Similarly with the psychiatrist. And then I think external barriers could be family members, right? Insurance, and all these other things. So I think it is difficult, very difficult for one to self-advocate for their needs and their wants. But I think there are also barriers to doing so.
Yeah, I mean, I think that's a really interesting and important point, right? Because sometimes our anxiety or OCD will get in the way of speaking up, and other times it might just be that we really just don't know or are not comfortable of how do I assert myself? How do I, right, kind of raise my hand and say, hey, wait a second, right? Because, the provider might be seen as an authority figure, or, they know better, and yet you might not feel like things are working for you, right? Or maybe even the relationship, maybe you don't feel like you can speak up. So with that, kind of what would you say might be some strategies of how can somebody kind of more effectively communicate their needs or their preferences to, let's just start with a medical, professional?
Sure. So I think one option could be for the patient to write down their concerns, right? Before a session, they could write their concerns down. And maybe if they don't feel comfortable sharing them out loud, they can hand the clinician the sheet of paper. These are some things I've been thinking about, and I'd like you to take a read. And that might be a bit easier than speaking out loud. Another strategy could be if one has family members or a close friend that's involved in their treatment, bringing that family member or that close friend into a session, asking the clinician, do you mind if this individual joins my session? And that could be another strategy, another way for messages to be communicated to whether it is the therapist or the psychiatrist.
Yeah, I love that actually. I'm a big fan of writing things down. And
Mm-hmm.
I will say, my mom, when she was here, but she would write pages in preparation
Mm-hmm.
for, seeing her doctor. And I used to kind of make fun of her, like, what are you doing? That's so many questions. You can't even get through all that. That's pages.
Right.
But, I will say in hindsight, I do think it's valuable. And I do think it's helpful to kind of, give you a chance to think through like
Mm-hmm.
what do I want to get out of this, or what is important to me, and take note of that, because we can all get a little uncomfortable when we're in that moment of like, and then we can forget, right? And so I love
Absolutely.
that.
And I think one other strategy is sending an email, right? Most clinicians, whether it's their direct email or you're emailing about larger practice, it could be easier for someone to send an email again versus saying it out loud during sessions. So that could be another option.
I love it. And so when we're talking about this stuff, so if let's say, or do you have any kind of opinion or thought around like, what about if people are not really able to access a professional? What if, I don't know, like it's too expensive for them? Or what if they don't have insurance? Do you have any thoughts on that?
In regard to getting treatment, is that what you're asking? Like
Yeah,
what
like
are some options?
how can they like
Yeah.
advocate for themselves to get, some of that support that they might need,
Hmm.
but that they might not, be able to readily have access to. Yeah.
Yeah. Well, I think if one does have health insurance, I think calling up your health insurance provider and not only with mental health, but I think individuals do this with other types of doctors as well. You can get a list of different clinicians in your area that might take your insurance. So that's one option if you have healthcare. Another option is a quick internet or Google search, right? So if you have access to a computer, looking for therapists in the area or close by. I think if one doesn't have health insurance, that's a bit trickier, which I think we can all agree on. And so when if one doesn't have health care, can you Google and find someone that does pro bono work, right? So I think these are a few different things one can be thinking about.
Yeah. And I think too, like, as you're saying that, what came to mind is, like, because I sometimes get, for example, messages of like, I don't have money, or I don't have access,
Hmm.
or I live in a part of the world where there
Hmm.
aren't, trained specialists who understand this. And, it breaks my heart. But the only thing I could think of is, like, especially at this day and age, from finding either a book that could be low cost, right? Or like it could be a self-study course that
Yep.
could be lower cost. There's information online that's free. But I think kind of what comes to mind is more that you find something that gives you a system, like a step-by-step
Yep.
process, because otherwise it could
Yep.
feel like you're kind of jumping all over and
Yep.
trying to pull these random things you're hearing, little tidbits, and put them together.
Hmm.
And that could be really, frustrating. And,
And I think also, even when we think about individuals with health insurance, good health insurance, and we think about residential treatment facilities and programs, oftentimes insurance companies won't cover the entirety of the stay. So I think that's something else that patients run into. Oh, all of a sudden, my coverage just got cut off, right? I was expecting to be here a lot longer. what now?
Yeah. So actually, let's get into that. That's a great segue into the next kind of topic discussion, which is how do you research treatment options, right? Because ideally, yeah, I mean, in the best case scenario, you'll find something that's a great fit. They take your insurance. It'll be for the length of time you want, and off you go. But that doesn't always happen. So how would somebody research it? How can they, make sure that they're part of kind of that decision-making process? What would you say to that?
So I think if one is being seen by an outpatient provider, there are times where the outpatient provider might say to the patient, I think that you would benefit from a higher level of care. And when I say higher level of care, I'm thinking a residential treatment facility, and that clinician might be able to provide some recommendations of specific places. But that's not always the case. I think that's the perfect world. If one is seeing an outpatient therapist and they feel as if they need a higher level of care, maybe framing it as a question to the clinician. I've gotten a lot of benefit from working with you. What do you think a residential treatment facility or a higher level of care would be beneficial for me? So I think those conversations start with the outpatient therapist and not being seen by an outpatient therapist. Again, I think doing an internet search, residential treatment facilities for OCD. But I think typically before one goes into residential treatment, these facilities and programs like to see that they've tried other options, if that makes sense.
Yeah, for sure.
So,
And yeah, let's talk about that for a second, if we may, just because I'm, if anybody's listening right now and maybe they haven't quite heard of this, like if we can break that down, what does that mean? Right. Because there's like a tier of services. So residential is kind of at the very top, but like what would go below that? What would be below that?
Sure. So I think if you have residential at the very top, then you have intensive outpatient, which could be partial day programs. So you're going in for part of the day, and there's individual group therapy. There's a psychiatrist managing one's medication, and then below that could be your typical once a week 50-minute session with outpatient therapist. You also mentioned that often think about residential treatment at the very top, but I have a bit of a different perspective on this in that I don't necessarily think one needs to have jumped through every other hoop before going to residential treatment or applying to be admitted to a residential treatment center. And I say that because there are others that are involved in this patient's life. And let's take OCD, for example, right? We know how it impacts family members. It impacts siblings, right? So I think when we think of residential treatment, it, is not only for the individual itself, but also could be for the parents and the family members who are struggling as well. They don't know what to do. They are accommodating because they think that's the right thing to do, but they're not very familiar with the disorder or not educated on the disorder. So I think these are just important things to keep in mind as well when we think about residential treatment.
Because we're talking about this, are there, just for the sake of, the listeners, some that we can name? Let's say some people maybe have heard of Rogers. I know is a big one that's known.
McLean Hospital in Boston. I was actually a patient myself at McLean. So that's another really strong residential program. But I believe McLean also has a campus in Texas, and Rogers has over the years expanded all over the country. But there are not a lot of options, which I think is also part of the problem. And again, if you have a certain type of insurance and these treatment centers don't accept that insurance, that's a barrier as well. So one can be doing everything the quote unquote right way, but there are all these external barriers that are just out of their control.
Yeah, absolutely. And I mean, you're talking about also like when we're talking about just care, and researching treatment options, it's understanding, like you said, right? Like what does each one require? Because you can have individual therapy, then you could have an intensive outpatient program, you can have a partial hospitalization, then you can have a full residential program. So kind of, what fits when and where, right? And And of course, looking at costs, looking at what can insurance cover, do you have any additional amount you might have to pay? I mean, these are all pretty important details to consider because, finances are, a big factor, of course, to getting a very specialized treatment, especially treatment for OCD, since this is the OCD Whisperer podcast. I'm going to talk about that for now. But, I understand there's, of course, substance use programs and, anxiety, depression, residential programs as well. But for the purposes of now, I definitely am very familiar with the OCD programs and kind of just understanding the financial impact as well that, people have to face and, sometimes take out loans or put things on credit cards and so on, and it's not like it's ideal, but if you're really struggling and it's very severe and intense, like what else can you do to advocate, right? What else can you do to get that help?
Yeah. And I also think that there's a common misconception in that when one goes to a residential treatment facility and they leave, the work is done. The work's really only started. And I think continuing that hard work and taking those skills that you've learned and you've built throughout your time at that residential program and continuing to use them after you leave is really, really important. So being set up with a good outpatient provider, which, there are folks at the the residential treatment centers that are responsible and helpful in doing that. So I think these are important things that people have to think about and consider as well, even when they have made it to the residential treatment center.
Yeah, I mean, I think that's a beautiful point, right? Because exactly right. It's not like you do a treatment, even if it's it's an intensive outpatient program that's three weeks, let's say, or, you're meeting with an individual therapist for, let's say 20 sessions, and you've got the skills. It doesn't mean, and you're absolutely right. That's a big misconception, thinking, okay, I'm going to do this and that's it. Boom, it's done. Everything is resolved, and it's all over. It's like, well, no. Yep. OCD is, there's a biological component in the brain. You're still going to have things that are going to trigger you and activate you.
Yep.
Right. And so how do you respond to those now differently, right? How do you understand yourself differently and how this thing called OCD works, right? So that you can keep applying the tools and the strategies. Like you said, the initial learning you get is just the start of that process. And then it's that continuation and bringing it into your life fully.
Right. And of course, when one is in a very controlled treatment center for however long it might be, it could be easier to do the exposures, right? Because you have eyes on you at all time. And then when you're thrust back into the real world, no one's watching you and you don't have that oversight that you previously had. So it is difficult. And that's why I think continuing the work with a strong outpatient provider is really, really critical and very important.
Yeah. And so with that, actually, let's talk for a second about how does somebody balance, there's family members, let's say that, have their concerns, right? And then there's you with OCD and you're also trying to find your own autonomy and kind of voice and independence in this. What would you say about that balance?
I think that's really tough. And I think as a patient, you need to, one should really educate themselves and really learn about the disorder. Like, what am I struggling with? How does it present? What are my triggers? So on and so forth. And before that work can really be done, or before the work with the family can really be done, I think the patient has to do all of those things. I think if those things are in place, this education piece is really, really, really critical for getting, whether it's family members, friends, and loved ones on board. Because again, back to this idea of accommodation, right? People, family members and loved ones often accommodate because they think it's the right thing to do, not because for no other reason, right? And once they are educated on the disorder and what OCD is and how the accommodation is really just maintaining their loved one's symptoms, they can't change. So I think this education piece is really, really, really important. And I think residential treatment centers do a nice job with that. They involve the family and the loved ones and the friends, whoever it is, in the treatment process, so everyone can learn and get on the same page.
I love it. Well, first of all, I want to just thank you for this conversation and coming here and kind of going over these different concepts, because I think people sometimes, if they haven't heard or don't know, they might not realize that there are different options available. Anything like we said, from free resources like YouTube channels. I mean, we're smart people nowadays, right? Chat GPT, Google. I mean, we have technology is moving at the
everything.
speed of light,
Yeah.
for goodness sakes, right? But then you also have providers, right, that you can find, like IOCDF. I know has a directory. I know ICBT.online, for folks who are interested in that. They have a directory, so
Hmm.
you can look and find folks who are trained to treat OCD. And then you can also look at different programs. And like you said, to your point, right, there are not that many residential programs, unfortunately. I mean, I, like, of those two. I don't know. And I don't know if if there's another one. Some folks I know have talked about different IOP programs, and I've certainly know there's
Hmm.
more of those around.
Yes, absolutely.
And I definitely also know that, ideally, if somebody can do an IOP program,
Hmm.
oftentimes that can really be a nice kind of midpoint
Yep.
before going to a residential.
Hmm.
Again, it's just, looking and finding the program that would be a fit for the person. And if sometimes you have to travel to have it or to get that service, then being
Hmm.
open to that, because there could be programs that are maybe in other parts of the states that you don't live in, but they take your insurance, for example. So that could be a thing to consider, I think, too. That
Yep.
might not be the first thing that comes to someone's mind.
And I think you mentioned it might not be the first thing that comes to someone's mind, but if it gets to the point where one's symptoms are so functionally impairing, that could happen over months. So it might not be initially, but over months, they become so functionally impairing, right? It's interfering with everything they're doing. It might be easier for them to driving a few hours to see a provider if that's the only option.
Yeah, exactly. And so I think from everything you're saying, kind of that's also what I'm gathering is, staying really flexible. And the truth is that there isn't, some like quick and easy solution, but taking a little time to do a little due diligence and do a little research, and like you said, write down some of those questions. Sounds like even maybe connect with a loved one that you trust, and see if there's other things, that perspectives or questions they might have that maybe you're not remembering, and kind of that balance you're walking of, how to kind of be at the center of, you making a choice of what feels
Yeah.
like a good fit for you, and
Yeah.
still that it has to be reasonable and kind of fit your specific criteria of what you're looking for.
Absolutely. And I also, I'm not sure if we mentioned this earlier when we were discussing different resources in this digital world. There are many different mental health podcasts. I know not all of them focus just on OCD, but if again, one has access to a computer or can go to a library or can borrow a computer or an iPad, they could tune into some of these podcasts to learn more about whether it's OCD or other psychological disorders.
Yeah. Do you want to name any that come on top of your mind?
So the OCD Whisperer is a really interesting podcast. The OCD Family Podcast is a really great podcast. So trying to think of like other OCD specific ones. I think those two come to top of my mind when I think of
And what about the
for
more broader
OCD.
ones?
I'm not too familiar with like the more broader ones, but if you Google like a list, or even so Light Up the Couch is one that I recently started listening to probably about 5 months ago. And if you do a search for Light Up the Couch in Spotify or Apple Music, many of the episodes are geared towards established or clinicians, but there are a lot of great takeaways and a lot of messages for patients as well. So I think that's another great one. Light Up the Couch.
Awesome.
Mm-hmm.
Yeah, I know. So I think the two that come to my mind is, I know Drew Ensalada has the anxiety, anxious truth, and he
Mm-hmm.
deals with panic, agoraphobia, and stuff like that. And I know Stu Ralph, he has
Mm-hmm.
he has also OCD stories and a lot of
Yeah.
interviews with clinicians and stuff like that. But yeah, there's so many shows out there now.
Yeah. And I think also, even if one does have access to a therapist or these programs, these podcasts are great because oftentimes it could feel very lonely, right? And you feel as if you're the only one going through this, or no one's ever had these type of obsessions or these type of compulsions before. So listening to some of these podcasts, right, you can hear other people's stories, which I think can provide a sense of comfort.
Absolutely. 100%. I think that's the most common. I know for me, when I kind of first put together this OCD, but right before that, yeah, I thought it was just me in my own little universe and
Hmm.
nobody else. And
Right.
as being a therapist over the
Hmm.
years, I'm like, oh my God, I hear that story all the time. And
Right.
so I think it's really important to know you're 100% not alone and not the only one at all by any means.
Absolutely. Yeah.
Awesome. Well, thank you so much for your time. Thanks for coming on the show and discussing this.
Yeah. Thank you so much for having me, Kristina.